Okay, here it goes. Okay, I'm Chelsea Cook, and my disorder was dissociative fugue. And these are some of the adjectives used to describe fugue states themselves by people who have suffered them. And to your right, this is actually some artwork um, done by somebody who had actually suffered a fugue state. So the words they used to describe the state itself were terrifying, shattering, confusing, and life altering. Okay, so what is dissociative fugue? It's one or more counts of episodic amnesia, and it's usually triggered by stress or trauma. A lot of times, a person will experience high amounts of stress or witness or go through kind of like a traumatic event. And usually sometimes it's usually tied to traumas or stress in the past and sometimes early childhood, things like sexual abuse and other kind of childhood traumas or case histories of that have been reported. So what kind of distinguishes dissociative fugue from other dissociative disorders is the unexplained travel or exodus from basically normal range of area like job, house, anything like that, and either assumption of a new identity or failure to recall original identity. And it's distinguished from amnesia because the patient regains memory of prior identity. Some people say they'll experience regaining these memories kind of slowly, and some say they kind of just come back suddenly all at once. It depends. And even then, there are case studies of people only regaining partial memory of their actual identity. Like I said, most people will regain at least partial memory of original identity. The people who experience fugue states after they come out of the state itself usually have little or no memory of the fugue state itself, which can also be very stressful because people are very unaware of things that they have done or how they got to be somewhere that they are. Imagine imagine, waking up 3 states away and not knowing how you got there. It can be very confusing. Dissociative fugue itself has very little research done on it. Most information we have come from actual case studies. And for example, people will wake up with no recall for when, why, or how they kind of came to be in their present situation. And they'll have some of their prior memory come back to them, and like I said, they'll have little to no memory of the fugue state itself. Okay, so these are the symptoms as classified in DSM-4. The first one is predominant disturbance is sudden and unexpected travel away from one's home or customary place of work with inability to recall one's past. Confusion about personal identity or assumption of a new identity, either partial or complete. A lot of people will kind of come up with the basics, but they've been reported to really kind of have no history. They'll give you a name and kind of a basic background, but they won't be able to recall who their parents were or where they were born, things like that. Disturbance does not occur exclusively during the course of dissociative identity disorder and is not due to the direct physiological effects of a substance, for example, drugs, other kinds of medications, or a general medical condition. So things like temporal lobe epilepsy, other kind of forms of epilepsy, or even tumors or any other things malfunctioning in the brain. Systems cause clinically significant distress or impairment in social, occupational, or other important areas of function. I thought that one was a little obvious. Obviously, if you wake up and don't know where you are and how you got there, it can cause you a little duress. So the etiology, trauma or abuse, especially a childhood history, has been reported in a large number of cases. Stress, environmental, emotional, and physical stress. So stressful environment, emotional stress, sometimes maybe brought on by something else, or physical stress, if somebody had experienced, a physical trauma recently, and that could be a catalyst. Coping, and it's also seen as a coping or defensive mechanism against stress or trauma. A lot of times people often have trouble exactly pinpointing what triggered kind of the fugue state, but through therapy and stuff, they'll usually work on honing down, the factors in their life that kind of led up to the fugue state itself. Sexual abuse, especially in childhood, has been prevalent in case studies. It's also been seen in military personnel and veterans. A lot of times it can coincide with PTSD. Okay, so DSM coding changes. So in the DSM-4, it was actually its own separate diagnosis. And in the DSM-5, it's actually a sublet of dissociative amnesia, and it's a coding specifier. So basically, it's kind of coded under dissociative amnesia in DSM-5. So modern therapeutic approaches would be psychotherapy, which is usually the most prevalent form of therapy in people with dissociative orders. They also find hypnosis is sometimes effective, although it should be noted that false memory kind of plays a role in that, about whether these people are recalling memories that are accurate. And also art therapy. Whilst looking into this disorder, I came across a blog that kind of had a lot of drawings of people with dissociative disorders, and it was very interesting to see, because a lot of times in their art they'll almost have two separate personalities, or a lot of chaos and confusion alongside something that's kind of like calm and serene, or clear. Cognitive therapy is also used. So any kinds, a lot of helping out with negative thought patterns, negative patterns of behavior, things like that. Drugs like anti-anxiety medicines, antidepressants, and antipsychotics have been used to treat other comorbid disorders, but also seem to help decrease the reoccurrence of a fugue state. And then the DES scale is usually used by practitioners to help evaluate whether or not people have experienced symptoms of dissociation. And here's my works cited.